I've spent decades as an anesthesiologist, guiding thousands of patients safely through surgery. And let me tell you, what you've seen in the movies about anesthesia, the mask coming down, the world going blurry, and suddenly you're spilling childhood secrets to the nurses. It's partly true, but the real story is far more fascinating and carefully orchestrated. Because anesthesia is not quite sleep, and it's not quite death. It's more like a form of time travel where you can only leap forward. Today, I want to take you behind the curtain and share, from the perspective of years in the operating room, what really happens when you go under anesthesia. Especially if you're an older adult, this is something you should know because it can be one of the safest and most remarkable tools of modern medicine. What anesthesia really does. Anesthesia is like a reversible off switch for parts of your nervous system, but think of it less as a simple switch and more as a finely tuned dimmer. We can dial certain parts down while leaving others working. There are different types. Local anesthesia numbs only a tiny spot. Imagine your dentist freezing one tooth so you can't feel the drill, but you stay awake and fully alert. Regional anesthesia is like cutting power to an entire floor of a building. An epidural during childbirth is a good example. The whole lower body loses sensation, but the mother can stay awake, aware, and even talk throughout the process. General anesthesia is the one people fear most because it feels like giving up complete control. Here, the body is fully unconscious. You can't move, can't feel pain, and your brain won't record any memories. Yes, it sounds frightening, but here's what most people don't realize. This state isn't random. It's one of the most precisely engineered conditions medicine has ever created. Every drug, every dose, and every adjustment is measured to keep you stable. Think of it as a pilot guiding a plane through turbulence. The systems are complex, but the purpose is safety. What you experience versus what happens inside. If you've been through surgery, the outside experience feels deceptively simple. A bright operating room, more people around than you imagined, and a gentle voice encouraging you to take deep breaths. Then maybe you remember counting backward from 10, and suddenly you're waking up in recovery, as if no time had passed at all. But inside your body, an incredible chain reaction is unfolding. Sedation begins, your awareness dims, like a radio being turned down. Memory switches off your hippocampus, the brain's record button. Stop storing new information, which is why you don't remember the operation. Consciousness fades. The networks that normally let you interact with the world temporarily go offline. Pain and movement are blocked signals in your spinal cord, and pain pathways are silenced, so the body stays still even as surgeons work. What's astonishing is how fast this happens. Within about a minute, everything you know, awareness, memory, sensation, is paused. And the strangest part? You don't feel yourself slipping away. There's no sensation of drifting. One moment you're there, the next moment you're gone. That's why patients often say it feels like teleportation, as if you skipped time entirely. How the drugs work. General anesthesia isn't like flicking a light switch. It's more like shutting down a city grid, one neighborhood at a time. Different drugs target different pathways in the brain and nervous system. Propofol boosts GABA, a calming chemical your brain already uses. Imagine GABA as the brain's natural brake pedal. Propofol presses that pedal harder, slowing activity. Ketamine blocks NMDA receptors, which normally keep neurons excited and firing. Without them, the overactivity is dialed down like unplugging a noisy machine. Opioids such as morphine and fentanyl act like a shield, intercepting pain messages before they can even reach your brain's control tower. Together, These drugs change how your thalamus works. That's the relay center that decides which sensations get passed on to your conscious mind. Under anesthesia, the thalamus blocks most of the traffic, and your cortex, the area that gives you self-awareness, loses its normal rhythm. Consciousness slips away not because it's gone, but because its networks stop talking to each other. And here's something most people don't know. Anesthesia is not sleep. Brain scans under anesthesia look nothing like sleep patterns. During normal sleep, your brain cycles through predictable phases: light sleep, deep sleep, REM. Under anesthesia, those cycles vanish. Instead of cycling, your brain enters a flat, controlled blackout. That's why anesthesiologists call it a pharmacological coma, but crucially, one that is carefully maintained and fully reversible. Why memory suppression matters. Many people assume anesthesia is only about blocking pain, but memory suppression is just as essential. Imagine the nightmare of being paralyzed during surgery, yet still aware of what's happening. That extremely rare complication has a name: intraoperative awareness, and yes, it would be terrifying. This is where the genius of anesthetic drugs really shines. They don't just quiet pain signals, they also prevent your brain from pressing the record button. The hippocampus, the part of the brain that normally stores new memories, is switched off. So even if a stray sensation sneaks through, there's no way for it to be saved and replayed later. It's as if the camera is turned off, leaving no footage behind. For older adults, this is especially important. As we age, our brains may process drugs a little differently, but anesthesiologists deliberately use medications and doses that protect you from forming traumatic memories. This ensures that instead of remembering pain or fear, the only thing you recall is waking up safely after surgery. In other words, memory suppression isn't a side effect of anesthesia, it's one of its greatest protections. It shields you not only from pain, but also from the emotional trauma of ever having to remember what happened on the operating table. What my job really is. Sometimes patients joke that anesthesiologists just put people to sleep and then grab coffee. The truth is very different. Think of me not as someone pressing a sleep button, but as a pilot flying you through a storm. During surgery, I'm monitoring every heartbeat, every breath, every shift in blood pressure or oxygen. I'm adjusting medications second by second, anticipating problems before they appear, and guiding you safely until we land back in recovery. I don't walk away. I stay with you every moment. Waking up is different for seniors. Coming out of anesthesia is nothing like waking from a restful nap. When the drugs wear off, your brain's complex networks don't reconnect all at once. Instead, it's like lights flickering back on in different rooms of a house. Some come on quickly, others take a bit longer. That's why many people feel groggy, disoriented, or lose track of time. In older adults, this stage can be more noticeable. I've seen grandparents wake up completely convinced only a few minutes had passed, when in reality, hours of surgery were behind them. Others have described vivid dreams that felt real, or brief moments of seeing things that weren't there, what we call hallucinations. Occasionally, seniors may even develop a temporary condition called postoperative delirium, where memory, attention, or mood are a little off for a few days. But here's what's important. In the vast majority of cases, these changes are short-lived. The brain is simply resetting its circuits. With rest, gentle care, and proper medical monitoring, most people return to their normal selves within hours to days. Is it safe for older adults? This is the single most common question I hear from patients in their 60s, 70s, and beyond. Doctor, will I wake up? The reassuring answer is yes, almost always. Modern anesthesia is one of the safest areas of medicine. In fact, for healthy people, the risk of dying from anesthesia is far lower than the risk of being in a fatal car accident on the way to the hospital. Still, age brings natural changes. The heart may not pump as strongly. The lungs may not expand as fully. The liver and kidneys may clear drugs more slowly. These changes don't mean anesthesia is unsafe. They just mean anesthesiologists must be more careful, tailoring every plan to each patient. For older adults, this could mean adjusting medication doses, monitoring vital signs more closely, or even choosing regional anesthesia instead of general if it's the safer option. Every choice is deliberate and personal, designed to balance safety with comfort. So while the fears are understandable, the reality is that anesthesia for seniors is usually very safe, especially in the hands of a trained, attentive anesthesiologist. What you can do to prepare. If you or someone you love is an older adult preparing for surgery, there are a few simple but powerful steps that make anesthesia safer. Bring a complete list of medications. Blood thinners, heart medicines, and diabetes drugs can all affect anesthesia. Your doctor needs to know everything you take, even vitamins or herbal supplements. Follow fasting instructions carefully. Having an empty stomach prevents dangerous complications during anesthesia, such as food or liquid entering the lungs. Expect a little confusion. It's completely normal for older adults to feel forgetful, slow, or foggy after anesthesia. This is usually temporary and improves as the brain clears the drugs. Speak up. Don't be afraid to ask questions, share fears, or request clarification. I've had many conversations with patients in their 70s and 80s who were relieved simply by being heard. Feeling respected and understood is as much a part of care as the medical treatment itself. Preparing well not only makes surgery smoother, but also eases anxiety. Knowledge, honesty, and communication are some of the strongest safeguards for seniors heading into anesthesia. The human side of anesthesia. Think about this. In less than 2 centuries, medicine has gone from surgeons operating on awake, screaming patients to a place where we can stop pain, block memories, and even control consciousness while keeping you alive and stable. Anesthesia is one of the few moments in life where you literally hand over your existence to another person. And my job, what I've trained for my entire career, is to bring you safely back. For older adults, this trust feels even deeper. I've held the hands of many grandparents before surgery, looked them in the eyes and promised, I'll be here the whole time. And I always am. So the next time you or your loved one needs surgery, remember, anesthesia is not just falling asleep. It's a carefully orchestrated, reversible hijacking of the body and brain, one of the most advanced achievements in medicine. And if you wake up saying something funny or embarrassing, don't worry. It stays in the recovery room. If you found this helpful, give it a like, subscribe for more medical insights, and share your story in the comments. What's the strangest thing you or someone you know said after waking up from anesthesia? Thank you for watching. Stay strong, stay informed, and take comfort, because even in the later decades of life, anesthesia is designed to carry you safely through.